Doctors, what's the dumbest thing patients have lied about? Story number 1. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications, when they clearly aren't, which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us, telling stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he always used his medication correctly, and after we did so many changes with his medication in many different ways, it's only natural to think that there's some problem with how he's taking them, if he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also obviously discovered that he indeed would not take his medications correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man that didn't had much contact with his family anymore, but mostly because his family didn't reach out to him almost at any given time, even though everyone lived close by, and in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time, they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Story number 2. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie, since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that, found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Story number 3. Not a doctor but an anesthesia nurse, but a mom directly lied to us about her 12-year-old pre-and surgery. We always confirm with the patient and legal guardians all the pre-surgery checkup: name, age, date of birth, any past medical history, common medication, and medication took in the last 24 hours, surgery proposed, last time you eat or drink anything. The thing is, in the last item of the checklist, the mom lie. Her answer: no, he doesn't eat anything since yesterday. The kid confirmed. Note that it was for PM. Outcome: Surgery went well, no problems. When comes the time to remove the tube, the kid starts vomiting tons of rice and beans. When I say tons, I mean at least 1 kilogram of said food. The kid aspirates part of the food against our best efforts. We aspirate, do everything we can, including a bronchofibroscopy. Everything ends up okay. The kid survived, no further complications, and recovered to full health in only 2 days. When confronted about the lie, Anne explained how her son could have died. The Karen mom said, "What could I do? He was hungry and eats like a bull. Who am I to say he can't?" We all lost our patience and just said, his mom, he could and was close to dying because of this. Story number 4. Nurse here, the absolute dumbest thing patients have said, and to be fair, this was the patient's parents, since I was in petty, but still dumb and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one and by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient, where is my patient?" I'm like, what? I go in and ask the parents, and no, in fact, they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations. Which fortunately there weren't. I'm fascinated that people can collectively think, yeah, let's do this, no one will know, like, how does that even play out in their minds? Story number 5. Had a patient show up there with a wound to the back of her head. I say, "Hey Ms. X, what happened?" "I don't know. I picked up chicken from the gas station and went to bed, and this morning I noticed I was bleeding. I start inspecting the wound, looks like it tracks pretty far, and there's this strange cotton-like material sticking out that is also tracking too deep to visualize. I press her some more about the circumstances because my dark spider sense starts going off. Me? Were you assaulted? Did someone harm you? Were you in a car accident? Did something fall on you? Patient, no. I just went to bed. Maybe I got up in the middle of the night to use the bathroom. Finally, I decide to send her through the donut of truth, aka get a CT scan of her head before me and my trusty scalpel start seeing where this trail of mystery cotton leads. The lady had a bullet lodged up against her skull bone. Still don't have an answer to the cotton, but I'm guessing the gun fired through some cloth. When I told her she had a bullet in her head, her response was, "Oh, weird," and then she went back to playing Candy Crush on her phone.